Hello, my name is Sara Maines, and I am the Liver Cancers Program Director at Global Liver Institute, the world's premier liver patient organization. We bring together more than 200 organizations across our councils, campaigns, and events to advance liver health as public health, to both prevent liver disease and scale optimal approaches to improving the lives of individuals and families impacted by liver disease and liver cancers. GLI's October is for Livers campaign is the first global program dedicated to public awareness, policy, and clinical practice needs to prevent and manage liver cancer while educating and empowering those living with and impacted by liver cancers. The 2023 October is for Livers campaign has been pushing boundaries in equity, advocacy, and innovation all month by connecting diverse communities around the world to collectively tackle liver cancers. The whole is truly greater than the sum of its parts, and this couldn't be more accurate to describe GLI's value of driving a better future in liver health through a global approach. With today's policy briefing being the latest broadcast for October is for Livers 2023, we would be remiss to not thank and acknowledge our dedicated Liver Cancer Council members, sponsors, and supporters who make this successful month possible. We extend our deepest thanks to AstraZeneca, Eisai, Genentech, member of Roche, Novo Nordisk, and TriSalus Life Sciences for sponsoring this year's campaign. Thank you. With excitement for today's conversation, Preventing, Diagnosing, and Treating the Third Deadliest Cancer, a policy on liver cancer, we are hearing about GLI's policy priorities relevant to liver cancer with Sara Van Geertruyden, partner at Thorn Run Partners. We also welcome important updates from 3 coalitions or partnerships that GLI is involved with. Jody Hoyos with Prevent Cancer Foundation, Tracy Zvenyach with Obesity Action Coalition, and Megan Dunn with Deadliest Cancer Coalitions. Sara, thanks so much for being here today. I'm excited for everyone to learn more about the policy work we are doing and focusing on.
Thank you, Sara, for inviting me to participate in this great discussion about Global Liver Institute's policy initiatives and priorities. So my name is Sara Van Geertruyden, as you have heard. I am with a firm called Thorn Run Partners, and we have been providing policy counsel to Global Liver Institute since February of this year. Really excited to be here and to share a little bit about what GLI has been up to in terms of public policy and some of our accomplishments as well. So I'll go ahead and dive right on in. So Thorn Run Partners is a firm here in Washington, D.C. that provides this kind of counsel to a multitude of clients, and we have a significant focus on healthcare. So I've actually known Donna Cryer with Global Liver Institute for a long time, and it's just been an honor and a pleasure to work with her and the whole team. So among our accomplishments, I wanted to share with everyone how excited we are that the organ transplant legislation that folks have been fighting for so long is finally passed. Yay. Donna Cryer was actually able to join the president at the White House for the signing ceremony after the bill was passed. As many of you may know, Donna has testified twice on Capitol Hill in support of this legislation. And was finally successful after the last Senate hearing when I think push came to shove and there was so much bipartisan support, it was unavoidable that they needed to go ahead and get this thing passed. We were also very excited to see HRSA, the Health Resources Services Administration, which implements the organ transplant program. They came out also saying that they were very eager to initiate regulations in light of the organ transplant bill being passed. So this has been a really great and tremendous victory for patients, and will hopefully bring some much needed modernization to the program. So many of you know that Global Liver Institute has an advanced advocacy academy. We were really excited after they met just recently. We were able to go to Capitol Hill on October 2nd, which, as some of you may remember, was right in the middle of a potential government shutdown. We actually didn't know if our meetings were going to happen until the Saturday before, but we were still able to pull off almost 60 meetings with members and staff on Capitol Hill on that day. And during those meetings, we talked about several issues. And, to begin with, you can't talk about policy right now without talking about appropriations, which is the reason that there was almost an imminent shutdown. In the appropriations process, I think it's important to recognize that there's a House process, which is, struggling right now as they struggle to identify a speaker. Their appropriations process was largely partisan. And did have across the board cuts to many of the programs that healthcare advocates care about, particularly in liver disease. In the Senate, which was a little bit different, it was a very bipartisan process. Some of the key provisions that were included in the Senate bill was report language directing the National Cancer Institute to form a multidisciplinary working group of clinical trials and translational research advisory committee, and issue a report listing suggested research focus areas for liver cancers. There was also report language encouraging AHRQ and others to evaluate the prevalence, diagnoses, and treatments and complications associated with NAFLD, and also increased funding for the Division of Viral Hepatitis and some small increases to the National Cancer Institute and NIDDK, which handles digestive, diabetes, kidney diseases. While on Capitol Hill, Global Liver Institute advocates also were able to talk about their support for the Living Donor Protection Act. This is a largely bipartisan bill. As you can see, it's got a multitude of co-sponsors in the House and in the Senate. It's really exciting. I think it's got, a decent chance of moving forward sometime in the next year during this Congress. Right now, as I understand and what we learned on Capitol Hill, is that the authors are engaged in a process of getting technical assistance from agencies like the Department of Labor on some of those key provisions as they try to settle on final language that could potentially pass and give it a path toward final passage. Some of the things that bill does are to prohibit insurance companies from denying or limiting coverage and from charging higher premiums for living organ donors. It amends the Family and Medical Leave Act of 1993 to specifically include living organ donation as a serious health condition. It directs HHS to update their materials on live organ donation to reflect these new protections and encourage more individuals to consider donating an organ. It's a really interesting, I think, and necessary bill, as so many liver patients are waiting for a donor. And the more donors we have, the more chances those people have of getting a donated organ. We were also really excited to advocate for the Medicare Multi-Cancer Early Detection Screening Coverage Act, which I know is a mouthful. Again, this one has a significant number of co-sponsors, largely bipartisan. It actually did get a hearing in the Energy and Commerce Committee in the House on September 19th. This is a bill that would modernize the Medicare program and create a benefit category for these kinds of multi-cancer early detection tests, which would then allow CMS to initiate an evidence-based coverage process for multi-cancer tests under FDA approval. This is also a really exciting bill for if you think about it in the context in particular of the cancer moonshot. In order for us to achieve those kinds of reductions in cancer and cancer deaths, it's going to be imperative that we have early diagnosis. I myself often imagine, what it would be like to go to the doctor and through such a simple test, learn if I have cancer and what part of my body I have cancer in. So it's going to be really important as these kinds of technologies are more and more improved by the FDA for them to not only be approved by the FDA, but also to be accessible to patients. The Treat and Reduce Obesity Act is another piece of legislation that's extremely important to the liver disease and liver cancer community. I'm sure you've read a lot about this legislation. It has been caught up in a lot of politics around whether or not Medicare should be covering these kinds of obesity treatments and for whom. Right now, the bill that's been introduced in the House and the Senate is bipartisan. The House bill has 46 co-sponsors as of today. The Senate has 15. There are a lot of discussions going on too, based on CMS and their technical assistance as to what the final language should look like. The concern, I think, that's really holding up its passage at this point is the potential cost. It has not yet been scored by the Congressional Budget Office. That being said, there's been significant research and a lot of reports that have come out recently talking about how 2/3 of active military service members are overweight or obese, and how CMS could potentially cover treatments under existing law if they were to recognize obesity as a disease. So I think you're going to see a lot of these types of reports and advocacy efforts influencing what also happens to this bill long term. It's a real concern that when the Congressional Budget Office scores a bill, they don't account for long-term preventive savings. And there are efforts on Capitol Hill to also address that issue. That's something that was heard a lot during our meetings on October 2nd, was the concern for the budget impact and how the increased cost associated with the bill would be paid for. So some of the provisions that are included in that act include expanding Medicare coverage to include screening and treatment of obesity from a diverse range of healthcare providers who specialize in obesity care, as well as coverage of FDA-approved medications for chronic weight management. This became a real challenge because way back in 2003, when a drug benefit was added to Medicare, it excluded coverage of weight management drugs. And so there has been a large effort to differentiate these new treatments for obesity with what was deemed weight management drugs back in 2003. So we were excited too, though, that this bill got heard in the Energy and Commerce Committee during that same hearing on September 19th. It does seem like it's got a tremendous amount of momentum behind it, but hasn't gotten through this year. But I think has some strong potential for movement next year. Another bill that came up during our discussions was the Saving Access to Laboratory Services Act, or SALSA. It's also a bipartisan bill, somewhat newly introduced in the Senate, so it doesn't have a lot of co-sponsors. This is a bill that would modify provisions related to Medicare payment rates for clinical diagnostic lab services. Those payment rates are currently slated to be reduced dramatically in January. And if they do get reduced, it's going to have a serious impact on people's access to care. And I think there's a lot of concerns in particular about labs in, say, rural areas, areas that don't have a lot of places to go to get those kinds of tests. So the goal here is to improve access to testing, support that clinical lab infrastructure, and make sure that we're investing in that kind of innovation. This one has not gotten as much attention as some of the other bills that we've discussed. That being said, it is time sensitive. So we're hopeful that, advocates through advocacy, that this is something that could potentially get done. I know a lot of folks are concerned about the hepatitis C elimination program and eliminating hepatitis C more broadly. We're very excited, and Global Liver Institute was such a leader in raising the concern around hepatitis C. I think one thing you always have to keep in mind when you think about hepatitis C and the fact that there are curative treatments on the market is that if you eliminate hepatitis C, what a service that would be to achieving the cancer moonshot and reducing liver cancers. Upwards of 80% of people with hepatitis C go on to have liver cancer, and it's a tremendous challenge, especially because liver cancer is one of the cancers that's rising, not falling. If you eliminated hepatitis C, you could just do a lot to reduce liver cancer. So what's in the president's budget is to accelerate the availability of point-of-care diagnostic tests, provide broad access to curative hepatitis C medications through a subscription model, advance comprehensive public health efforts to engage, inform, identify, and treat people with hepatitis C, all in the name, too, of reducing liver cancer. There's several significant champions, including Dr. Francis Collins, who, as you may remember, was the former NIH director. This is a tremendous priority for him. He had a sibling that died of liver of hepatitis C. And it's also a priority for our congressional hepatologist, Dr. Bill Cassidy, in the Senate, and Representative Hank Johnson. So we are really excited that it's in the president's budget. We are all eagerly awaiting to see legislative language so that this can be added to our list of priority bills for advocacy going forward. What we have been hearing is that there's a lot of momentum behind the drafting. That being said, we don't have a bill yet. So more to come. We hope that we have a lot more to report on hepatitis C next time we reach out. In other legislation, the Protecting Healthcare for All Patients Act is another piece of legislation that I know has been really important to the Global Liver Institute. We don't anticipate this one moving this year, although we are hopeful that it has some potential to move next year. This is a bill that I think, in light of some of the work that's been done by Global Liver Institute with the Institute for Clinical and Economic Review, is very important. As some of you may know, the ICER, the Institute for Clinical and Economic Review, is an organization that conducts value assessments of healthcare, and it uses a metric called the Quality Adjusted Life Year to do so. The Quality Adjusted Life Year has been heavily criticized by researchers and by people with disabilities, older adults, people with serious chronic conditions, because of the way it devalues lives lived with a disability in its measurement of the value of life extension and in the value of incremental quality of life improvements. Because it gives a lower value to lives lived in a state of disability, it then devalues the treatments for those conditions. A lot of people, may not ever reach this optimum one, or the full value of life in a year. Some people may be at a 0.5 and under the scale. So it's a heavily discriminatory measure that has raised a lot of concerns. And this bill would essentially say that it cannot be used in federal programs to determine what is covered. It wouldn't be able to be used to determine, for instance, utilization management strategies by payers. So there's a lot of hope for this bill to be passed. Now, there's currently a QALY ban in Medicare, and so this bill would essentially extend that ban to other programs, including Medicaid. It did get through committee. It has not achieved final passage, but we are eager that that the health ranking member, Anna Eshoo, on the Energy and Commerce Committee, is working with the committee staff in hopes that this, when it does reach the floor, is bipartisan. At this point, it is not bipartisan, although there are hopes that it will be. And I also wanted to just touch on the Medical Nutrition Equity Act. This is a piece of legislation that has been introduced in the past, but has not been reintroduced. As I understand, they're just looking for a Republican lead sponsor in the House. The prior Republican that led this bill retired. That being said, I know it's a serious priority for Global Liver Institute and other entities, other organizations for whom medical nutrition is a really key component to the prevention and treatment side of their condition. So some of the provisions that are included in the Medical Nutrition Equity Act are ensuring both public and private insurance cover medically necessary foods as a treatment option, which are required to support proper growth and development and to prevent medical complications, severe disabilities, and death. And the legislation is also narrowly drafted to ensure it only covers patients for whom the physician prescribed or ordered medically necessary nutrition constitutes the treatment. So fingers crossed that going into next year, this bill is introduced. And once it is reintroduced, I would imagine that Global Liver Institute and its advocates will want to strongly support it. So that's the summary of where we are in terms of our policy work on Capitol Hill to date. We really look forward to hearing from you as GLI advocates about what's important to you. So please keep us in the loop, keep us posted, and to the extent that you also want to engage with us in these policy advocacy activities, we would love to have you join us. Thank you very much for having me.
Thank you so much for having me, Sarah. I'm really excited to be here. I'm Jody Hoyos. I'm the CEO of the Prevent Cancer Foundation. We are the only US-based organization solely focused on cancer prevention and early detection. And cancer screening is an enormous part of the work that we do, because we know that cancer screening equals early detection, and early detection equals better outcomes. The 5-year survival rate for cancers detected early can be up to 90%. And that drops down to a 5-year survival rate of 21% when cancers are detected in later stages. So the work we're doing, and some of the work that I'll highlight this afternoon, is about multi-cancer early detection screening tests. So right now there are 5 routine screening tests that are reimbursed by Medicare. Those screening tests are lung cancer screenings, cervical cancer, colorectal cancer screening, prostate, and breast cancer. So when we look at that information, 5 routine screenings probably feels like a lot sometimes, but up to 70% of cancer deaths are caused by cancers with no routine screenings, or screenings that fall outside of those 5, or people who are eligible for those 5. The Prevent Cancer Foundation has been working on legislation with many of you in your organizations, to include the Global Liver Institute, which is the Medicare Multi-Cancer Early Detection Screening Coverage Act. This piece of legislation helps ensure that there's a pathway to coverage for multi-cancer early detection screening tests, so that when they are FDA approved, there is a way for those to be covered for people in the Medicare population. It does not mandate coverage. It just enables a pathway for the Center for Medicaid and Medicare Services to take a look at those tests after FDA approval and doing national coverage determination. The multi-cancer early detection screening tests are tests that enable many cancers to be detected through a single blood draw. So cancers for which we do not now have a screening, so outside of those 5, we can now pick up signals or identify the potential presence of cancer in many, many more types of cancers. And again, those are not yet FDA approved. There's not yet coverage, insurance coverage for those tests, but the legislation can help us get there. What we don't want to have is a delay in the ability for people to get the screening tests after FDA approves these tests covers these tests or approves these tests. So it's the Medicare Multi-Cancer Early Detection Screening Coverage Act. There are over 500 organizations from across the country that have signed on to, in agreement that this should move forward. And it is that the legislation has been introduced in both the House and Senate, and now we are waiting for actual passage of the bill. Hopefully that will occur this year, and we will certainly be keeping the greater community at large apprised of where we go. If you're interested in learning more, please go to preventcancer.org/early for more information about these tests and about the legislation. Thank you so much for having me. I look forward to hearing what the next presenter has to share.
Thank you so much. It's great to join you today, and greetings from the Obesity Action Coalition. My name is Dr. Tracy Zvenyach, and I lead policy strategy and alliances at the OAC. The OAC is the leading national nonprofit dedicated to serving people living with obesity through awareness, support, education, and advocacy. Our vision is to create a society where all individuals are treated with respect and without discrimination or bias, regardless of their size or weight. We strive for those affected by the disease of obesity to have the right to access safe and effective treatment options. We educate all individuals to understand that when it comes to health, weight matters. OAC has a strong and growing membership of over 80,000 individuals living with obesity from across the United States and some from around the world. Obesity is a serious chronic disease driven by strong biology, not by choice. We also know that obesity and liver disease are closely linked. OAC and the Global Liver Institute have worked together for many years on ways to improve the lives of people living with obesity and liver disease. We recognize that obesity is a major driver of NAFLD and NASH, where around 50% of NAFLD patients and 80% of NASH patients present with obesity. My husband is the perfect example of this. Dave lives with mild obesity, yet he already has developed NAFLD, prediabetes, and high cholesterol. We struggle to get him care for his chronic diseases because our health insurance policy excludes coverage of weight loss treatments. So the connection between obesity and liver disease is very real to me and my family, as it is for thousands of OAC and GLI members. OAC focuses on advocacy and policy efforts to improve access to care for people living with obesity. Unfortunately, it's quite common for individuals with obesity to struggle with accessing treatments and services that can help them manage their weight and health. One of the top barriers to accessing care includes limited or no health insurance coverage. Together with GLI and other partners, we are working on improving access to obesity care in Medicare for older adults, in Medicaid for low-income Americans, and across employer and commercial health insurance. On a positive note, we have seen progress in access to care for veterans through the VA, for active duty military through the Department of Defense, and for federal employees through the Federal Employee Health Benefit Program. One of the key policy proposals advocates are trying to advance is the Treat and Reduce Obesity Act. This is a bill in Congress that would increase access to obesity care for older Americans in Medicare. The bill would expand types of providers that can deliver intensive behavioral therapy, and that it would remove restrictions on FDA-approved medications for obesity. These are important evidence-based interventions in obesity management that lack appropriate coverage today. So advocates for obesity care have been working on advancing this policy for several years because we know that when Medicare makes a change in policy, most other insurance follows. Having access to obesity care is important for people living with liver disease too. We know that obesity alone is also a risk factor for liver cancer, where obesity is associated with 2 to 3-fold increase in the risk of hepatocellular carcinoma. The risks are very real for people living with both obesity and liver disease. That is why working together with GLI and other coalition partners is central to advancing better care and improving the lives of people living with obesity and liver disease. OAC is here to serve individuals living with obesity through support, education, and advocacy. To learn more, please visit us at obesityaction.org. I thank you for the opportunity to join you today, and I look forward to hearing the next speaker.
So hi, I'm Megan Gordon-Don, and I serve as the Executive Director of the Deadliest Cancers Coalition. The coalition was started in 2008 as a place for cancers that focus on diseases or cancers with the lowest survival rate. So those are the 5-year survival rate below 50%. And it's a place for all of those groups to come together and work together on policy initiatives that are really focused across those cancers. one of the things that we have come to realize is that the conversation that patients have with their physicians when they have one of the deadliest cancers is markedly different from that a patient who's diagnosed with a cancer with many treatment options and a better survival rate has with their physicians upon diagnosis. And our goal is that we get to a point where all cancers are able to have, our patients diagnosed with any cancer can have a conversation with their physician about a range of treatment options that offer them a good chance at survival. And we've got a long way to go for deadliest cancers, but we are working very hard. And I want to thank the Global Liver Institute for their partnership in this coalition and in these initiatives. It really means a lot that we are all able to come together to work on these things together with one voice. So some of the key things that we work on, first and foremost, getting more funding, research funding, federal research funding for these cancers. And that means increasing federal funding for the National Institutes of Health and the National Cancer Institute. We have also worked to get a new institute called ARPA-H, or Advanced Research Projects for Health, that stood up, and that is an opportunity to really focus on high-risk, high-reward research projects that could make a significant difference in cancer and other diseases. And they have started some really interesting projects that could make a real difference for deadliest cancers. So we're excited about that. One of the key things that we work on at the National Cancer Institute, or with the National Cancer Institute, is trying to get what's called report language every year in the congressional appropriations bills. And this is language where Congress, who decides how much funding goes to the National Cancer Institute and all the other institutes of the NIH, gets to tell the NCI some key things that they need to work on. And so we have been fortunate that for the long time, probably 10 years running, we've been able to get report language that asks the NCI to focus on the deadliest cancers. And for the last couple of years, we've gotten report language that specifically asks the NCI to look at liver cancers, including cholangiocarcinoma. And so that language has also been included in the bills so far for fiscal year 2024, which is what Congress is focusing on right now. And we are hopeful that it makes it into the final bill, but we'll have to see the final bill in order to see if that has worked. But huge thank you to GLI and to all of your advocates for everything that you do to create a focus on liver cancer and the need for more liver cancer research funding, and for partnering with the Deadliest Cancers Coalition.
Thank you, everyone. Today's updates have been motivating and educational, and I'm so happy that all of you joined us today to tune in, and thank you to the 4 of you who spoke today. Sara Van Geertruyden at Thorn Run Partners, Jody Hoyos with Prevent Cancer Foundation, Tracy Zvenyach with Obesity Action Coalition, and Megan Don with Deadliest Cancer Coalitions. We are grateful for your partnership and for your commitment and passion to our cancer community and liver cancer community. Thanks to all of you for joining us for today's policy briefing on preventing, diagnosing, and treating the 3rd deadliest cancer, and for continuing to support the October is for Liver's 2023 liver cancer campaign. For more information about GLI, please visit us at www.globalliver.org or visit www.livercentral.org, GLI's hub for all things liver cancer research and resources. Thank you so much. Have a great day.